Okay, so I just washed my hands. Hi, I'm Donna. I'm going to be your nurse today. Can you state your name and date of birth for me, please?
Yes, my name is Miriam Nasser. My date of birth is 125.
Okay, and then do you have any allergies?
No.
Okay. I'm going to first begin with assessing my patient's general appearance. So she doesn't look like she's obese. Her hygiene, she looks like she does take care of herself, so she's in good hygiene. Her health, she looks like she maintains good health, and then also she's not in any like sort of distress, so she's not breathing rapidly or having trouble breathing. Okay, so I'm gonna assess person, place, time, and situation. So do you know who you are?
Yes, my name is Miriam Nasser.
Okay, do you know where you are?
The hospital.
Do you know the time?
8:30.
And do you know why you're here?
For a regular checkup.
Okay, so now I'm gonna ask my patient if she can follow basic commands, and with that, I'm gonna begin with asking her to do a hand grasp, and I'm gonna do that bilaterally. So can you just grasp my hands? Okay, and then also wiggle your toes for me. Okay, so with that, I'm gonna grade it a 5 out of 5 for muscle strength. So she was able to follow basic commands. Now I'm gonna assess for PERLA, which is pupils equal, round, and reactive to light and accommodation. Okay, so first I'm gonna look for if the pupils are round and equal bilaterally, which they are. And now I'm gonna see if her pupils will constrict to the light. Okay, and they are. And for accommodation, what I would do is with my pen light, I would just go back and also forward and see if her eyes will follow the pen. Okay, so now I'm gonna inspect the precordium for symmetry. So I'm gonna be looking at precordium and seeing if everything looks symmetrical. And with that, I'm also gonna try and locate her apical impulse, which is on the left fifth intercostal space. So my patient's left, and that is clearly visible, and that's also at the point of maximal impulse. So now I'm gonna palpate the chest wall for any tenderness or heaves and thrills. So I'm just gonna palpate here. And then do you feel any tenderness in any of these areas?
No.
Okay, and there's no heaves or thrills either. Okay, so now I'm gonna start with auscultating my patient's cardiac field. So I'm gonna first start with the diaphragm. So just take a deep breath in and out for me. So first I'm gonna start with aortic. So my patient's right. This is right. This is right. Okay. So just to take a deep breath in and out. And then pulmonic. On herbs. Again. And then tricuspid. And mitral. Okay, so with that, I was able to clearly hear the S1 and S2 sounds. So now I'm gonna use my bell, and with my bell, I'm gonna try and locate if I can hear any swishing or whooshing sounds that would indicate if my patient had an underlying condition that can affect her health. So I'm just gonna go ahead and also take the same areas. So aortic, again, deep breath in and out. Okay, pulmonic. Okay, herbs. Tricuspid. Mitral. Okay, so I did not hear any whooshing or swishing sounds, which is good. So now I'm gonna assess and grade my patient's pulses. So first I'm gonna start with the carotid pulses, and I'm gonna do this one at a time. And there's 3 areas. So first I'm gonna start behind the ear. Okay, right here. Okay, and I'm gonna do the other side. Okay, so my patient's pulse was clearly felt, so I'm gonna go ahead and grade that a 2+. And now I'm gonna do I'm gonna see the femoral pulses, and that would be right in the inner thigh. Okay, and that is also felt, so I'm gonna go ahead and grade that a 2+. Now for the radial, I'm also gonna grade that. Okay, I'm gonna do the other side. Okay, and I'm also gonna grade that a 2+. Now I'm gonna do the popliteal, which is behind the knee. So again, I'm gonna do this here. Okay, and then other. Okay, so that is a 2+. Now their dorsalis pedis, which is found on the foot. So, okay, I'm gonna grade that a 2+ as well. So all pulses were felt. Now I'm gonna assess for edema in the extremities, and I'm gonna do that bilaterally. So first I'm gonna start with the arms. Just lay out your arms for me, please. Okay. And then the legs. And you can also do the feet. Okay, so no edema was present, so I'm gonna grade that as 0. Now I'm gonna inspect my patient's chest shape. So they're while also looking for my patient's AP diameter. So I'm just looking here. And my patient's AP diameter is 2:1, which is a normal ratio. Okay, so now I'm gonna also take my patient's anterior and posterior lung fields with my diaphragm. And I should be able to clearly hear resonance sounds. So first I'm gonna start with the anterior lung fields, and I'm just gonna do 4 locations for this. Okay, so deep breath in and out again. Okay, so resonance was clearly heard. There was no like crackles indicative of any underlying conditions that would affect her lungs. So now I'm going to do the posterior lung fields. And with this, I'm first going to begin with C7 to T3 locations. So again, same thing. Okay, so I did C7 to T3 and then also T3 to T10. And resonance sounds were clearly heard in all of those lung fields. So now I'm gonna assess my patient's abdomen shape. So I'm gonna ask you to lay flat first so that I can also take
Flat on my stomach or my back?
your back. Okay, so my patient's abdomen looks flat. And now I'm gonna go ahead and also take her bowel sounds. So there's 4 locations. So there's the right lower quadrant, right upper, and then left upper, and then left lower. So I'm gonna first start at the right lower. And with this, I'm just gonna try and listen for any tympanic sounds, which would be normal. So okay, so right lower. Right upper, left upper, and left lower. Okay, so all vowel sounds were present. If they were not present, I would listen for the full 5 minutes. Tympanic sounds were clearly heard. There was no hypoactive or hyperactive vowel sounds. Okay. Now I'm gonna also do palpation. So first I'm gonna start with light palpation, and then I'm gonna do deep palpation. And with this, I'm looking for if my patient feels any tenderness. So first I'm gonna start with light, and I'm gonna go in the same order. Any tenderness?
No.
Tenderness?
No.
Tenderness?
No.
And then deep palpation, so tenderness?
No.
Tenderness?
No.
Tenderness?
No. No.
Okay, so my patient said she did not feel any tenderness in any of those areas. Okay. So now I'm going to assess my patient's skin color. So her skin color remains the same throughout her entire body. Her temperature, so I'm going to use the dorsal aspect of my hand. So I'm just going to do this bilaterally. So give me your arms for me, please. Okay. I'm going to do the legs. Okay, so her temperature is warm. There was no moisture throughout her body. I didn't notice any open wounds or any scars or like drainage or rashes or anything like that. And then lastly, I'm gonna assess my patient's upper and lower extremity strength, and I'm gonna do that bilaterally. So for upper strength, we're gonna do the bilateral hand grasp again. So just grasp my hands, okay? And then that's a 5 out of 5 strength. So now I'm gonna assess my patient's lower extremity bilaterally. So what I'm gonna do is I'm gonna pull my patient's leg apart and see if she can pull it inward against resistance. Okay, my patient can do that, so I'm gonna go ahead and grade that also a 5 out of 5 for strength. Okay, and that concludes the checkoff. So do you have any questions for me?
No, thank you.
Okay, thank you.